Mr. Speaker, delegates, AOA trustees, and honored guests. What a year. It was surely not what I thought I was signing up for. We have had unparalleled challenges, phenomenal opportunities, effective reorganization, innovative governance, and some remarkable successes for our profession over this past year. The thing that I give credit to for our ability to meet the challenges, seize the opportunities, and have successes has been the absolute willingness for all of us to stand and work together. From each and every one of you in your practices, to our remarkable board of trustee members, every volunteer member of our bureaus, committees, and councils, every member of our outstanding AOA staff, and their exceptionally qualified AOA senior leadership. And of course, our dynamic Chief Executive Officer, Kevin Clower, DO, EJD. Now, last year at this time, our immediate past president, Ronald Burns, described an upcoming year of transition and reimagined innovation. Boy, did he hit the nail on its head. We did not fully envision that it would be an entire year before we might be crawling out from the overwhelming effects of COVID-19. He did emphasize that the American Osteopathic Association had been transitioning into a true physician-led, physician-directed organization over the previous 2 years. And that was the mantra that we followed this year. The glue that held us together was the across-the-board willingness of every single person to work together as a team. And I assure you that your organization is the epitome of a true cohesive partnership between governance and policy and operational delivery. I have jokingly referred to myself as the AOA's first virtual president. Over the past year, I've presented to over 50 state affiliate societies, specialty societies, committees, commissions, and organizations. But only 4 were face-to-face. And all of those occurred within the last 6 weeks. The rest have all been virtual. Dr. Jaimo and I have attempted to virtually attend every monthly departmental meeting and to participate in as many bureaus, committees, and council meetings as we could. Every 2 weeks, the executive leadership team met to update current issues and activities. And the CEO and I had weekly calls, and I don't have any idea of the number of unscheduled calls. And the executive committee or the full board of trustees met on a monthly basis virtually. This resulted in clearly defined direction and common purpose. Now, our overwhelming issue this year, of course, has been addressing COVID-19. We have worked diligently to provide direct and indirect support, guidance, and assistance for all DOs and osteopathic medical students throughout COVID-19 pandemic, while we simultaneously have been looking toward the future. In addition to supporting physicians and students during the pandemic, the operational priorities for my presidential year have been aimed at enhancing, building a bright future for our osteopathic profession. My first primary focus was to expand the osteopathic community. Currently, osteopathic physicians represent 11% of all practicing physicians in the United States. Osteopathic medicine is one of the fastest growing segments of healthcare, with a growth increase of 63% in the past decade and nearly 300% over the past 3 decades. Currently, there are now more than 135,000 DOs in the U.S. We graduate 7,000 new osteopathic physicians a year. And today, more than 30,000 osteopathic medical students, representing 25% of all medical students in the United States are learning at 37 colleges of osteopathic medicine at 58 teaching locations in 33 states. So as a profession, we are growing. And eventually, we should represent approximately 25% of all practicing physicians in the US. Now, while our total growth as a profession is encouraging, we still need to aggressively encourage all DOs to belong to their state affiliates, specialty societies, and the AOA. My second primary focus was to support the future of the osteopathic medical profession. We have now completed the second year of the single accreditation system for graduate medical education in the United States. And I need to reassure you that we are truly embedded into ACGME leadership. DOs now serve on 20 of the ACGME specialty review committees. 6 DOs now serve on the ACGME board of directors. And I am exceptionally proud to state that AOA past president Karen J. Nichols, DO, currently serves as the chair of the ACGME board. We are embedded. Now, while celebrating the many benefits this new era of the single GME accreditation offers current and future DOs, the AOA does remain focused on preserving the distinctive philosophy and principles of osteopathic medicine throughout the continuum of each DO's education, training, and career. We believe one of the best ways to achieve this is through expansion of osteopathic recognition in the ACGME programs. And this year, we have directed a focus on interaction with, support for, and connecting to not only our students, but our postgraduate trainees and new physicians in practice. My third presidential focus has been to enhance the AOA's public health mission. Especially in light of COVID-19, we had to encourage patients to continue routine immunization. Once COVID vaccines were rolled out, we have been advocating for our physicians, their staff, and patients to get those vaccines. Perhaps the greatest lesson from this pandemic is the disproportionate expansion of healthcare disparities in this nation, significantly highlighted once healthcare resources became scarce and our system was stressed, especially to underrepresented minority populations and communities. So the AOA has amped up its game with respect to public health, and we are enhancing the AOA's public health mission to play a key role in addressing healthcare disparities and access to care. And we are committing time, energy, and resources to this. And lastly, with respect to public health, we have advocated for and strengthened our efforts to address the opioid crisis. COVID-19 has not lessened this crisis. It has worsened it. Now, I must speak to you about osteopathic certification and services. Osteopathic board certification is the culmination of our osteopathic education. It indicates that we are fully trained, certified osteopathic physicians, and it should be the board certification of choice for DOs. AOA Certifying Board Services launched the Ambassador Program initiative in January of this year. The goal of the Ambassador Program is designed to build personal relationships with residency program directors in order to firmly solidify AOA board certification as the preferred pathway for all DOs, and additionally, The ambassadors will encourage program directors to seek osteopathic recognition of their residency programs. In November of 2020, the AOA removed all previous barriers to AOA certification for ABMS certified DOs and established a time-limited, exam-free pathway for ABMS certified DOs to obtain AOA board certification through their corresponding AOA specialty board. Certification application fees for AOA members are waived, and we've had over 600 applicants to participate since November. I call this "It's Not Too Late to Come Home" program. And AOA specialty certifying boards are moving away from the high-stakes recertification exams and transitioning to longitudinal assessments for osteopathic continuous certification component 3. The initial focus will be on the primary certifying boards, and they are beginning to launch into this transition at this time this year, with the expectation that the full transition for all primary certifying boards will be complete by October of 2022. Then the transition to the subspecialty certifying boards will commence, and you will receive additional information on this transition through your primary certifying board as they finalize their individual longitudinal assessment plans. I'm excited to announce that we have launched the AOA's new 2021 to 2026 strategic plan, which will guide our work in the service of our members and the profession during the next 5 years. This was a culmination of a 9-month planning process through virtual focus groups and membership survey findings. This new strategic plan has identified 7 priority objectives and supporting strategies for implementation and sets us on a path to redefine, redirect, and revitalize the impact of the AOA within the osteopathic profession and in the lives of the over 160,000 osteopathic physicians and medical students that we currently serve. And your involvement is key to the success of this plan. We look forward to continued partnership with you in alignment with a common vision and a shared strategy for advancing the distinctiveness of osteopathic medicine. Now, at the AOA, we aspire to be a model organization, creating and sustaining a community that promotes values in diversity, equity, and inclusion, including equitable delivery of healthcare. This spring, the AOA Board of Trustees approved a diversity, equity, and inclusion DEI policy to develop and promote our DEI efforts. And as part of this commitment to creating a self and welcoming workplace and in compliance with AOA policy and federal and state law, the AOA will provide DEI training on an ongoing basis to all employees and, starting this fall, to all bureau, committee, and council members. Now, one of the things that I am personally so proud of that we've done this year is direct, aggressive approach that the AOA is now taking with respect to protecting our profession. During the first week in October of 2020, as the immediate past president of the United States battled COVID-19 under the care of Sean Conley, DO, his personal physician, a wave of confusion and broad mischaracterizations about osteopathic medicine were made by online news media and in the printed news. They made it clear that many in the media did not understand the scope or status of osteopathic medicine. and many incorrectly implied, and in some cases, outright claim that osteopathically trained physicians, DOs, are less qualified than allopathic physicians, MDs. The AOA initiated an immediate, timely, aggressive public response to these libelous insults. Our overall goal was not to suppress the negativity, but to seize the conversation and opportunity and to amplify awareness of the issues and replace the negative and inaccurate narrative with our accurate and positive narrative, and to create a movement using the AOA's resources and expertise to advocate loudly for our profession. Your AOA leadership firmly believes that this should be one of the AOA's primary responsibilities. It's an obligation to the profession, and perhaps really one of the greatest values provided by the AOA. Now, a second series of assault on our professional identity occurred in mid-October and November of 2020. An advertising concept from a professional scrub manufacturing company in the form of television ads that were denigrating specifically to women, women DOs, and women leaders. Within hours of each occurrence, the company was contacted by our CEO, and we demanded immediate removal of the advertisements, which occurred that day on both occasions. The company committed to correcting these mischaracterizations. They acknowledged an error in judgment and agreed to multiple restitutions, including a donation of $100,000 made to the AOA, which was used to focus on our diversity and inclusion efforts, our gender equity in medicine efforts, and creating awareness and understanding of the osteopathic profession. Additionally, their marketing director was subsequently replaced, and they created a nationally televised advertisement that includes a woman DO that portrays woman physician, women DOs, and osteopathic physicians in a very positive light. We had some concerned Colorado members that brought to our attention that a physical therapist in Colorado was advertising her offerings of osteopathic services. It is our belief that such claims are not only deceptive to the public, but they are also tantamount to the practice of osteopathic medicine without a license. In December of 2020, the AOA and 7 individual physicians filed a lawsuit against the American Board of Internal Medicine, the ABIM, in the U.S. District Court in Philadelphia, challenging a policy stating that residency and fellowship program directors must be ABIM certified in order to qualify residents for the ABIM exam. This policy disadvantages DOs certified by the American Osteopathic Board of Internal Medicine, who are fully qualified by ACGME policy to serve as residency program directors. And your AOA leadership and our entire board of trustees stand united in support of our osteopathic colleagues. And the AOA has continually advocated this year on behalf of osteopathic medical students and residents who have encountered discrimination from audition rotation sites and residency programs that exclude DO applicants. We established a grassroots notification network for students to notify the AOA about any rotation discrimination activities and intervene on their behalf with favorable resolutions with respect to the eligibility for osteopathic students for clinical rotations and to discontinue policies that allow institutions to charge osteopathic medical students higher fees than those charged to MD students for completing audition rotations. And recently, the American Academy of Physician Assistants, the AAPA, voted to change the professional name of physician assistant to physician associate. This action prompted your AOA leadership to decide that it was more than appropriate for our professional association to issue a public position on this action, and at the same time to clearly state our profession's positions, not only on the physician assistant title change, but including our position on non-physician clinician use of the title doctor, and our position on physician-led healthcare. The position paper was approved unanimously by the Board of Trustees and published on May 28th of 2021. This action has engendered significant positive response on social media, to include from many MDs. Now, all of these decisions required immediate action, and except for the ongoing lawsuit, were successful. The lawsuit is still continuing. Be assured that current AOA leadership and your incoming AOA leadership and the Board of Trustees are fully committed to the aggressive, consistent response to any actions that degrade our osteopathic profession. Now, these highlights focus on just a few notable items that have occurred this year. Trust me, we have been busy. And although the medical profession has endured a year of immense challenges, I have never felt prouder to be a DO or more excited about the promising advancements on the horizon for osteopathic physicians. In addition to taking advantage of all the AOA has to offer throughout your education, training, and career, I sincerely hope that you will remain connected to your osteopathic family by being an active member of the AOA, your state osteopathic medical association, and your specialty society. And every student should be a member of SOMA and the AOA. So every one of us who are AOA members must individually encourage any DO that we may know who is not a member to join. Our profession is making a significant impact on the health of our country. Don't be a DO in name only. Join incoming President Jaimo and the rest of our osteopathic family as we move osteopathic medicine forward. I personally thank you again for the absolute privilege and honor of serving you. And especially, I thank you for what you do. But remember, be DO proud. Thank you very much.